right now, healthcare is an episodic event, meaning when you get sick, you come to the doctor, we see you. Now, what's going to be game-changing is we're going to be able to do healthcare on a more continuous basis. And one of the things that Vancive allows us to do is actually take a look not just at how you're doing at a given moment, but over the course of an entire week. And tell us about what you're doing.
Thanks, Gary, for giving me this opportunity to talk about our wonderful product. Here we have what's called the Metria Lifestyle Assessment product. It's a very easy to use product. It's a true wearable in that you stick this onto your body. With this product, you can get very accurate lifestyle information for a lot of the things that you mentioned over a course of 1 week. Things like activity levels, calorie expenditure, sleep duration, sleep quality, and for additional research purposes, we offer other metrics that might be useful for somebody like you, a physician or a researcher. Where would this be useful? For a lot of wellness purposes. Like you said, healthcare here today is episodic. Maybe there's a before and after. Somebody is going through some kind of therapy regimen and you're interested in baselining them first before they embark on their regimen. Maybe it's over they want to lose weight and there's over a 15 or 16 week period. Maybe you can monitor them repeatedly and seeing how well they're doing in their progression. So it has a lot of applications. Truly, this is one of the more unique products in this whole space because it was designed from a health and clinical standpoint in mind, and more importantly, it was important to put the data in the hands of providers and experts such as yourself, a physician or a researcher, who can package that information and provide the right context for the data that you're seeing, and more importantly, is provide actionable information to the patient or the member or the user to go do something useful, rather than just say, here's the data, okay, now what, right?
So we end up with a real-time piece of data that tells us how your week was, how much you slept, what your activity level was, what your blood pressure was running, what your body temperature's been during that time period. So we get a lot of data that we're going to be able to turn around and not just advise the patient in terms of how to improve their health care or how to change supplements or medications that might give them better results, but also data that we can use to take to the insurance companies and say, look, this is what the patient's struggling with. Here we have real-time data in terms of what's going on with them.
Absolutely. I mean, it's so amazing that all these days in healthcare, nobody actually provided the context. I mean, you often say, you ask the patient, do you recall what you were doing when this happened, this or that clinical condition happened? Well, now you don't have to guess. If somebody says, doctor, I didn't sleep for 7 days, you could say, you know what, really? Let me see this data, put it on him, have him come back after a week later, and you can actually get objective data on saying, did you not sleep, or you're sleeping better than you think you are? You can get really good objective data and have the right context for a lot of the clinical decisions you're going to make and you're going to ask them to follow as a physician.
Very exciting technology, very affordable technology, and stuff that we can put in place tomorrow when we get back to the office. So thanks very much. I really appreciate it. I'm looking forward to working with you.
Thank you, Gary.